Okay, let's jump right in. You know, when you think of Southeast Asia, maybe you picture bustling markets, ancient temples, incredible landscapes.
Hmm.
But underlying all that vibrant life, there's a health challenge that's, well, it's on a truly staggering scale. Did you know this region is home to about a third of the world's entire population of tobacco
It's
users?
huge.
We're talking over 411 million adults spread across just 11 countries. It's a number that really makes you pause.
It absolutely does. And what really came through as we looked into this is that stark contrast you mentioned. A region seeing rapid economic and social change, but at the same time, it's grappling with what is arguably the single most preventable cause of death globally.
Right.
It makes Southeast Asia just a critical place to watch in the global fight against tobacco.
Exactly. And that's why we wanted to take this deep dive into the material. Our mission really is to cut through the noise, pull out the most important insights, and help you understand the full picture here, the scale, the dynamics, the progress, and the persistent challenges.
Yeah, we're going to unpack the sheer size of the issue, look at the different ways tobacco is used, because look, it's not just cigarettes.
Hmm.
We'll explore the surprising ways the industry tries to stay relevant, see where progress is actually being made, and confront the very real human and economic costs. It's quite a story.
So settle in. Let's get into what really stands out when you look closely at this information. It's a complex narrative, sometimes difficult to hear, but also one that contains some significant moments of hope. Let's start by truly grasping the scale, the sheer size of what we're talking about.
Well, when we talk about 411 million users,
Right.
it's easy for that number to feel a bit abstract, right?
Yeah,
But think about it globally. There are about, what, 1.245 billion tobacco users. So yes, literally 1 in 3 are right here in Southeast Asia.
1 in 3.
And within the region, the data clearly shows India accounts for a really significant chunk of that total.
It's not just a statistic, is it? It's a public health crisis playing out day after day because we know tobacco is directly tied to these non-communicable diseases, NCDs, things like heart disease, a whole range of cancers, diabetes, chronic lung conditions.
Exactly. These are the illnesses that just devastate lives and put immense strain on healthcare systems everywhere.
And the ultimate cost is just immense. Globally, tobacco kills over 8 million people each year. That alone is hard to comprehend.
It is. But what's truly shocking when you drill down is the concentration of that loss. 3.1 million of those deaths occurred just within Southeast Asia.
Wow, just in Southeast Asia.
There, 3.1 million.
To put that in perspective, I mean, the material compared it to losing the entire population of Singapore every 2 years.
Yeah, that comparison really hits home. It's a relentless, ongoing tragedy that just underscores how urgent this whole issue is.
Okay, so amidst that really challenging picture, there is an important piece of good news, particularly when it comes to smoking cigarettes, right?
Yes, that's right. The data shows some pretty significant progress has been made in reducing smoking rates. Between 2000 and 2022, smoking among men in the region dropped from nearly 69%. Think about that. Almost 7 in 10 men.
Wow.
Down to about 44%. And for women, the decline was even more dramatic. It fell from around a third, 33.5%, down to less than 10%, about 9.4%. That is substantial progress.
That kind of reduction, yeah, that represents a major public health achievement. It's got to be a testament to years of hard work on the ground.
Definitely.
But here's where the story gets, well, complicated. Because despite those real wins against smoking, Southeast Asia still holds this dubious distinction of having the highest overall tobacco use prevalence globally.
That's the twist.
Yeah, it's standing at 26.5%, just slightly ahead of Europe.
And that's why, even with the progress in smoking, the region as a whole is falling short of that global target. Remember, the goal was a 30% reduction in overall tobacco use by 2025 compared to 2010 levels.
Right, 30% by 2025.
Yeah, well, the world is only on track for about 25%. And Southeast Asia's high overall prevalence is a big, big part of that story.
And we also see real variation within the region itself. It's not all the same picture.
No, not at all. Countries like India and Nepal are actually bright spots. They're projected to meet that ambitious 30% target, which is fantastic news. Really positive.
That's great.
But then you look somewhere like Indonesia, for instance, and the data points to a projected increase in overall tobacco use.
An increase, not just failing to decrease, but going up.
Exactly. So it's clear the fight is, far from uniform across the region.
And that leads us, I suppose, to what we might call the other tobacco problem, the one that isn't always in the headlines. Smokeless tobacco.
Ah, yes. The silent force, perhaps. Because while smoking rates are dropping in many places, the information reveals smokeless tobacco is this massive and in some areas actually a growing challenge.
The numbers are just, well, they're hard to get your head around.
Absolutely astonishing numbers here. Southeast Asia is home to 280 million smokeless tobacco users. Let that sink in.
280 million.
That's 77% of the global total, right there.
And drilling down even further, the sheer concentration in India is remarkable. India accounts for 250 million of those users.
250 million, which means India has 90% of the world's smokeless tobacco users within its borders. It's just staggering.
90%. And when we talk about smokeless tobacco, what exactly are we including?
We mean products like chewing tobacco, things like Gutka, Masala, snuff, basically, things that are often placed in the mouth, held there, rather than inhaled like cigarette smoke.
Okay, and it's crucial, absolutely crucial, to be crystal clear here. The idea that smokeless tobacco is somehow a safer alternative to smoking, that's just a dangerous myth.
A complete myth.
Yeah.
It is absolutely not safe. No way.
Okay.
What's particularly concerning is that these products contain over 30 known carcinogens, 30 cancer-causing chemicals.
30.
And we see direct links to severe health outcomes, oral cancer, obviously, but also pharyngeal cancer, esophageal cancer, cardiovascular diseases, gum recession, and this terribly debilitating condition called oral submucous fibrosis.
What does that do?
It essentially causes the inside of the mouth, the tissues, to become stiff and fibrous. Makes eating, speaking, even opening your mouth properly really difficult over time. It's dreadful.
That sounds awful. And the data, it really highlights the scale of the harm, doesn't it? In India, where smokeless tobacco is so prevalent.
Yeah, in India, oral cancer is the most common cancer attributed to its use. We're talking over 95,000 new cases diagnosed every single year, just from that.
Over 95,000 cases a year.
And something that really jumps out from the data is this alarming trend. We see in countries like India, Bangladesh, and Nepal, while their smoking rates were dropping between, say, 2009 and 2017.
Which is good news.
Which is good news.
Yeah.
Yeah, smoking down by 3% in India, 6% in Bangladesh, 7% in Nepal in that period. But smokeless tobacco use was actually climbing during that same time.
Oh, really?
Yeah, up by 6% in India, 3% in Bangladesh, 4% in Nepal. It's almost like, some users might be shifting from one dangerous form of tobacco to another.
Which naturally leads us to think about the strategies employed by the industry. This isn't just a cultural habit happening in isolation, is it? The tobacco industry is actively involved, constantly adapting to, well, maintain and expand its user base.
Oh, absolutely. They are very much focused on promoting what are called new and emerging nicotine and tobacco products, NENTPs.
Right, the acronyms. So what are those?
Think e-cigarettes, heated tobacco products, those flavored nicotine pouches you see now. And the way they are marketed is often quite deceptive, playing on themes of being cool or modern, or misleadingly suggesting they are less harmful than cigarettes.
Which is often unproven or just wrong.
Exactly. And the impact on young people is it's heartbreakingly clear in the data. It's estimated that 11 million adolescents, kids aged 13 to 15, in Southeast Asia are already addicted to tobacco products.
11 million kids.
11 million. That's nearly 30% of the global total in that really vulnerable age group. Imagine millions of kids potentially facing a lifetime of addiction before they've even finished secondary school.
It's terrible, and the marketing seems deliberately targeted.
Oh, clearly. It's designed to appeal to youth, and also specifically to women in some cases. We see glossy advertisements, really vibrant packaging, and flavors that are deliberately attractive. Mango, mint, bubblegum.
Flavors that sound like candy.
Exactly.
Yeah.
Like candy, not a dangerous, addictive substance.
And we see the impact on women too, especially with smokeless tobacco, right? While smoking rates might be relatively low for women across the region, smokeless prevalence can be much higher.
That's right. The data points to 12.8% of women in India using smokeless products. And a particularly striking figure, 27.9% of women in Bangladesh use them. Compare that to, say, Thailand, where it's only about 1.1% among men using smokeless. Big difference.
So that really shows you how deeply cultural factors and maybe that targeted marketing intersect.
Definitely. And a particularly concerning finding is the prevalence of smokeless tobacco use among pregnant and lactating women in India. One survey found roughly 4% of pregnant women and 5% of lactating women using these products.
During pregnancy and while breastfeeding?
Yes. And the health consequences there are devastating. Increased risk of stillbirths, low birth weight babies, various neonatal health issues for the newborn.
Yet I gather some of these products are still marketed almost benignly, like breath fresheners.
Incredibly, yes. marketed as breath fresheners or maybe aids for stress relief, which shows a complete disregard for the severe risks involved, especially during pregnancy.
Okay, now it is important to step back and reiterate, despite these huge challenges, significant progress has been made. You mentioned the drop in smoking.
Yes, absolutely. The overall reduction in tobacco use between 2000 and 2022, particularly that incredible 72% drop among women smokers, that's a major victory. Can't understate that.
And that progress didn't just happen by accident. It's the result of really dedicated work by governments, civil society, public health advocates, all implementing evidence-based policies.
A lot of this work, yeah, draws on the WHO Framework Convention on Tobacco Control, the FCTC. You hear that mentioned a lot.
Right.
And its empower provisions. These are sort of the key pillars. Monitoring use, protecting people from smoke, offering help to quit, warning about dangers, enforcing advertising bans, and raising taxes. Empower.
Okay. And we see actual examples of these policies working in the region.
Oh yes, concrete examples. Thailand was the first in Asia to implement plain packaging for cigarettes, stripping away that branding appeal. 7 countries, places like Bangladesh, India, Thailand, have adopted these large graphic health warnings, some covering up to 85% of the cigarette pack surface.
Really prominent.
85%, that's most of the pack.
Huge. And countries like the Maldives, Nepal, and Timor-Leste are actually global leaders with some of the largest warning sizes anywhere in the world. That's a powerful visual tool, isn't it? Designed to make the health risks just undeniable every time someone reaches for a pack.
Exactly. And circling back to India for a moment, its progress really is a bright spot in the overall picture. It's on track to significantly reduce its overall tobacco use prevalence from 13.5% back in 2010 down to an estimated 8.5% by 2025.
That's a big drop.
It is. And Nepal is also showing strong progress towards meeting that 30% reduction target.
And taxation, that's part of the Empower package. Does that work?
Yes, taxation has played a crucial role. Raising taxes on tobacco simply makes it less affordable, which we know is particularly effective in discouraging young people from starting in the first place. And Thailand has even taken the innovative step of using revenue from tobacco taxes to fund further tobacco control initiatives. Kind of a virtuous cycle.
That's smart. It's fascinating, really, to see how these evidence-based policy interventions actually translate into real-world reductions in tobacco use and help push towards those global health goals.
It shows what's possible.
But the cost isn't just measured in health outcomes and, tragically, deaths, is it? There's a massive economic burden associated with tobacco use in Southeast Asia.
Absolutely massive. The data from India alone is just eye-watering. In 2017-18, the economic cost of treating tobacco-related diseases was estimated at a staggering INR 171,341 crore.
Okay, what's that in, say, US dollars?
At the time, that was equivalent to USD 27.5 billion, just for 1 year in one country.
$27.5 billion.
Yeah. And if you look at some older data focusing specifically on smokeless tobacco costs from way back in 2004, even then, the direct medical costs were already USD 285 million.
Back in 2004.
Yeah, plus you had indirect costs like lost productivity, caregiver time, adding another USD 104 million. So totaling almost USD 400 million back then. You can only imagine how much higher that figure is today, especially with the rise in smokeless use we talked about.
And this raises a crucial point about equity, doesn't it? Who bears these costs?
Exactly. The data consistently shows that tobacco use, particularly smokeless tobacco, is much more prevalent among less educated populations and those with lower incomes.
Right. So the burden of dealing with diseases like oral cancer, the treatment costs, the time off work, the disability, it falls disproportionately on the communities least equipped to handle it.
Precisely. And that often leads to worse health outcomes, higher mortality rates among these already vulnerable groups. It exacerbates inequality.
And when we look at the global picture of just smokeless tobacco...
Globally, smokeless contributes to over 650,000 deaths annually and something like 4.7 million disability-adjusted life years lost dailies, a measure of overall disease burden.
And Southeast Asia?
Well, with Southeast Asia being home to 82% of the world's smokeless users, it's clear the region bears the overwhelming majority of that huge economic and health burden from smokeless tobacco specifically.
So despite the policy wins and the real progress against smoking, quitting remains a significant challenge, especially, it seems, for smokeless users.
It really does. And something that stands out is how deeply embedded smokeless tobacco is within cultural practices in many parts of the region. You know, places like India, these products are just commonly available at local shops, like the little chai stalls on the corner. They're integrated into the rhythm of daily life.
And people use them for perceived benefits sometimes.
Yeah, often people use them because they think it helps cleanse teeth or freshen breath or maybe relieve stress perceptions that unfortunately the industry sometimes plays into or encourages.
And a major hurdle is just people don't know the risks.
That seems to be a big part of it, a lack of awareness. Many users are genuinely unaware that these products contain dangerous carcinogens and pose severe health risks. They might assume they are safer than cigarettes because they're not smoked.
Which is just not true.
Not true at all. And we see this reflected in the low quit attempt rates reported. In Bangladesh, only about 29% of smokeless users even tried to quit in the past year. In India, it was 35%, and a concerningly low 22% in Thailand.
That's a huge population using a deadly product that isn't even trying to stop.
Exactly. It highlights a massive gap in cessation support and awareness.
So while most countries in the region have ratified the FCTC, the Framework Convention,
Yes, most have. Indonesia is the notable exception, the only country in Southeast Asia that hasn't ratified it.
right, so while most have ratified it and are implementing measures like Empower, there's clearly a long way to go, particularly in tackling the smokeless challenge and really boosting cessation efforts.
Well, absolutely. And this whole picture strongly supports the call for bolder action that we're hearing. The WHO Regional Director for Southeast Asia has specifically highlighted the need for things like comprehensive bans on those new emerging products, the NETPs we discussed.
Ban them outright.
That's the call, yes. Along with better and more accessible services for people trying to quit. Much stronger protection of public health policy from industry interference. That's Article 5.3 of the FCTC, a key provision.
Protecting policy from lobbying and influence.
Exactly. And engaging youth through campaigns to build what they call tobacco resistance, getting ahead of the curve.
It really feels like the region is at a critical crossroads, doesn't it? There's this undeniable, significant progress happening, driven by strong policies and public health efforts, especially against smoking. Huge wins there.
Definitely.
But that progress is being challenged, maybe even undermined, by this rising tide of smokeless tobacco use and the industry's relentless, adaptable tactics targeting new users and trying to keep existing ones hooked.
That sums it up well. And what's clear from all this is the need to treat smokeless tobacco with the same urgency and, frankly, the same regulatory rigor as cigarettes.
What would that look like?
Well, implementing bans on those appealing flavors, requiring large graphic warnings that cover most of the pack, just like for cigarettes, and undertaking widespread public education campaigns about the very real dangers, making sure people know it's not safe.
And protecting policy.
And crucially, yes, protecting public health policy from any influence by the tobacco industry remains absolutely paramount. That Article 5.3 is key.
So wrapping this up, what does all of this tell you, the listener? This deep dive into the Southeast Asian experience, I think it shows us the incredible power of targeted public health efforts, like those that have dramatically reduced smoking rates, real successes. But it also vividly illustrates the persistence and adaptability of industries promoting harmful products and the complex interplay between global health policies and, deeply ingrained cultural habits or economic realities on the ground.
It's a powerful reminder, isn't it? Tackling major health challenges like this isn't a simple one-time fix. It requires constant vigilance, adaptation, and a really deep understanding of the specific cultural and economic contexts in which these issues play out.
Absolutely. And given the tobacco industry's history, its track record of finding new ways to market products and hook users, here's a final provocative thought for you to consider, pulled directly from the picture painted by this information. What is the next frontier in this ongoing fight against tobacco? What comes after e-cigs and pouches? And how can societies stay ahead of the curve to protect vulnerable populations, especially young people, from whatever product or tactic comes next?
That's the crucial question, something to really think about.
Thank you for joining us for this deep dive today.